So, Dirk, please, the stage is yours.
Yes, thank you. First of all, I would like to thank the organization again. I'm very honored to give a second presentation on this international forum. And again, I think it's really very well organized by doing the Zoom meetings. Yeah, because of the pandemic, everybody would love to meet each other in person, but I think it's not going to happen for the first year. But okay, well, let's do it digital like this. Here comes my presentation. Okay. So today I'm going to talk, of course, about the telemedicine and digital health. And the name of my presentation is Telemedicine Wheels in Motion. And again, I'm a Dirk. I'm an anesthesiologist. I live in the Netherlands. I live in Limburg, which will show a small picture at one of my other slides. So I live pretty close to Frank. I've never met him in person, only digital, but I hope it will be something for the next future. Like I said, I'm an anesthesiologist, but also a consultant in e-health and an entrepreneur in doing all kinds of e-health projects. I'm also a member of the ISFTH since a couple of years, which is a very nice organization. We really give a lot of information. So, well, telemedicine wheels in motion. If you have a close look at my first slide, you see in the upper right side, you see a lot of guys riding a bike through the mountains. And this is going to be the program. I will explain the title a little bit later. So a little bit introduction. And of course, the current problems arising due to the pandemic of COVID. Right now here in the Netherlands, we are going to the second wave with all the problems involved. But then I think that like putting on mobile solutions, which I present in a couple of slides, will be of helping us, the doctors, and trying to treat our patients well. And that's one of the things I will address, that the use of the head-mounted displays. Talk a little bit about the functionality and the scope of it. And of course, a lot of people are always talking about it. When do you have successful implementation, and especially upscaling, scaling up, which is of course one of the big challenges. Disclosures. I'm on a couple of medical advisory boards. I'm on a medical advisory board of Hippo technology. That's an American-based company who is specialized in the using of the head-mounted displays. I've been working for the company for a couple of months already, and it's really a clinician-led company. So people know how it works in the daily routine of doctors. Also, I'm on the board of the medical advisory board of DXC Technology. Same is for the IPQ Security organization here in Europe. That's an organization, very active organization, which almost all of the EMS organizations are coherent with each other and try to solve all kinds of problems, and also looking at digital ICT solutions in the acute care setting. Also, I'm running my own small e-health consultancy company called Tezo. Again, that's something of my bio. I live in Limburg. So Limburg, that's situated in the most southern part of the Netherlands. So it's pretty close to Belgium. And I always say to people, if I'm doing a presentation, not everybody in the Netherlands lives in Amsterdam. Amsterdam is, of course, a very nice city, but there are more places to live in the Netherlands, like in the most southern part. And that's also where the hospital is situated, where I'm working. One of the biggest and most modern hospitals in the Netherlands, also in Europe. And you see that the picture of the hospital on the left upper side. The two pictures below are the surroundings which I live. Limburg, famous for walking and especially for biking. You see my own bike in the right downside. I'm a fanatic race biker going up the hills here in Limburg. So if people like biking and want to come to the Netherlands, go to Limburg and you will have a fantastic time doing the biking. Again, telemedicine. So what are the current problems due to pandemic? And one of the things we saw during the first wave of COVID, that the patients were very reluctant to visit the hospitals, their house doctors, their general practitioners, because of the fear of getting infected. And because everybody was confronted with that horrible virus, nobody knew how to treat it, how the future was going to be. So people were scared of going to the hospital, going to the doctors, and to talk about the symptoms of diseases they had. And like I said, well, they did go to the healthcare professionals. And so one of the things is that a lot of people during the first wave were getting illnesses which were not treated because the people did not go to the doctor. So the doctor did not know what kind of disease the patients were going through. Of course, some things like the myocardial infarctions, the cerebral incidents, and also people with oncology. And so what people were going to the first wave, I think that the second wave was already going to the world, or at least here in Europe and the Netherlands, and it was the wave with the diseases of the non-COVID patients. Because the whole healthcare system was completely focused on COVID. Of course, that was very important, horrible disease, and it was very hard to treat in the beginning. And so now we went to the first wave. Then it was a couple of months, it was better, getting better. But now things are getting colder. People are more sticking together. So now we're going to a second wave. And so what we now see here, at least in the Netherlands, we have an overcrowding of our emergency rooms with COVID patients. And so we see that because of the overcrowding of the emergency rooms, ambulances have to wait in line to get the patients out of the ambulance and get them to the hospital. Some ERs have to be closed temporarily. Patients have to move away in their ambulances and transferred over longer distances. And so one of the things our government said, well, during the first wave, the COVID was very, very important. It still is, but now they also say, well, guys, doctors, you also have to look at the non-COVID patients. So that's also very, very important. And there's a necessity of continuation of healthcare to provide to the non-COVID patients. So then, of course, we have a problem, because now we have the COVID patients and the non-COVID patients. They're coming to the hospital, but people are still pretty scared to come to the hospital. So that's why I think what's very important is to give the patient care on a distance and patient monitoring on a distance. That is very, very important because you are old of age and you want to stay out of the hospital because you do not want to get infected. We also want to stay healthy, of course. The doctors have to look after you. And one of the things is that you really do the distant patient care and the monitoring. And so that's one of the things we now have to take advantage over because people are really in need of that. And also we need the virtual healthcare platforms. So that people and doctors can see the data of all the patients with the distant patient monitoring. So you need a healthcare platform where all the data is put together, and then you have direct access to the patient data. So then one of my really hot topics is the teleconsultation. Do it remote at home, but you can also do teleconsultation in the ambulances when patients are not doing well. I'm also a chronic pain specialist, and what I do is phoning a couple of hours a day, just the people at home, how they are doing. So they do not have to come to the hospital with the risk of getting infected, of getting contaminated. Although it's of course very safe in hospitals, the people just don't want to go to the hospital. And what's the best thing then to do? That if the patient is not coming to the doctor, and the doctor has to go to the patient, but then do it in a virtual care setting. So one of the things is if you do if you work with patients in a virtual care setting, you can do the triage. So with distant monitoring, you look visually at the patient. As a doctor, you can see, well, the patient is doing good, doing no good, or you have a look at the wound. Does the wound look infected? Does it have to go to the hospital? Yes or no? Okay, stay at home. The wound care nurse will take care of it, and there's no need to come to the hospital right now. So one of the spin-offs is, of course, if you prevent people coming to the hospitals, to the ERs, to the emergency rooms, then there will be less overcrowding, and that, of course, is better for patient care and safety of care. So I think the triage, again, that's very, very important. And so how do you do triage? That's a big word, do the triage. So that's what I think, that mobile solutions, like the device you see on the right downsides, are important. And well, I'm one of the advisors of this company. That's Hippo Technology. Again, it's an American-based company, and they are specialized in delivering the virtual care. And they have a virtual care platform, and they're working with the head-mounted displays. And there's always some confusion about the head-mounted display, if that's the same as Google Glass. Well, it's not, it's different. And the head-mounted displays, they enable healthcare providers and also educators, and Frank was also talking about that education is very important, to overcome the barriers of time, distance, and training. So if you use a virtual care platform or a head-mounted display, and you want to have advice from your doctor or some other organization from all over the world, you can have direct access by using this head-mounted display. It's a voice-activated sort of worn computer. And I've got one here to show. Now you put it on your head. And then here's the camera, and here's the ocular, in which you can look at PDF documents, and you can do you have access to your virtual care platform. And you can do AR, augmented reality, or virtual reality, and you can play in videos for training purposes. And the nice thing is it's mobile, easy to understand how it works, and very easy to operate. And but you have to think that a device like this, you have to see it as a tool. It's really a tool of delivering the concept of telemedicine. So again, here is the picture of it, and you see that the camera on the right side and the ocular, which you can see through. The right down side, that's the picture I've made. It shows a little bit how the solution works. So suppose you are the doctor, you're sitting behind your laptop on the right side, and then a nurse or another healthcare professional is sitting at home with the patient. The guy who's sitting at home with the patient has a device on his head. He films the patient, and he can directly talk to the doctor who's sitting at home and has a look at the laptop. So there are already some use cases with the devices. When the COVID-19 epidemic broke out in Wuhan, the HMDs were used by the frontline healthcare workers to provide specialist care to high-risk patients. So people who are treating the patients could have stayed in their room, and the doctor will give advice from a distance. And of course, you try to prevent and to minimize the risk of infection. Also, one of the things is, and it's if you look at the internet and the literature, that the thermal imaging is very important. There are ins and outs with thermal imaging, like diagnosing fever or higher temperature. But these are things which can be incorporated in the HMD. So then, of course, yeah, we have then I've pointed out that the HMD it's a tool, huh? And so when do we think it will be successful? And we have looked at some factors, and I've got them on this slide. And then one of the first things, it should be quick to deploy. It should be a plug-and-play installation with a remote setup, training, and ongoing support. So it does not has to take ages or weeks or months to get it done and running in your hospital. Also, of course, it should be easy to use. And easy to use, I've put it on the head of one of my sons. He's 8 years old, and he directly within a couple of minutes he knew how it worked. It's voice activated. It's very accurate. Also, if you work in noisy environments, like if you use it in an ambulance, you got the sirens on it, or you use it at the trauma scene on the street, it works. One of the other things is, you have to use the device on various environments, so to be dust-proof and waterproof, and should be a rugged design. You can drop it from a couple of feet and it will not break. And that's one of the other things, of course. It should be fully networked. Most parts of the world have access to 3G, 4G, 5G. with a lot of coverage. And so the device is like this, that it can integrate seamlessly with any or almost any hospital and connected device. So that's one of the things. It can be globally deployed, and especially now with COVID. So if we work globally together, then we try to give better patient care and try to beat this horrible virus. Safe and secure, and should be scalable. As an open IPE is allowing for a range of third-party applications to integrate into the various systems, so it solves the solutions. There are also some use cases in the US, like used at the John Hopkins hospital, and also in Norway. Yeah, you see the guy in the middle. He's working into the snow, and he's connected with the device. The device is on his head, of course, and he's talking to the doctor in the hospital or some emergency room. And also it's used in Nigeria. So this is it. It's a global deployment. So all over the world, doctors can connect to each other, use a virtual care platform like this, and exchange ideas about treating all kinds of symptoms and diseases. Again, very important, the use for the emergency services. You get a real-time direct advice for the paramedic, and you get a faster triage. The better your triage is, the better the patient outcome will be. And also, at least one of the ideas we have to transport the COVID or non-COVID patients to different locations, so that they will not cross. Also classroom, Frank, again, to all the training, and medical students, faculty training, and evaluation of skills, and also, of course, very important, home nursing care, like doing IV treatments, wound care, and also can send biometric data to the hospital. And this is also very important that we have to work together. And here comes a little bit the explanation of my wheels in motion. And if you look on the left upper side, you see a lot of guys riding their bikes, and one of them is falling. And why did he fall? Well, usually nobody knows, because I think he fell because he wasn't working together. If you work together, you talk to each other, you look at each other, then you will not fall. And what happens if you fall? Then things start breaking up, and then you will not go forward anymore. So work together so that you will not fall, and that your bike doesn't break. Because if you look at the right downside, the bike is completely broken. It will not ride anymore. And so the whole implementation and the use of digital health and technology will stop. So you have to prevent it. So we have to work together. If not, failure of implementation. And so you have to keep your wheels in motion. And one of the other things I would like to point out, I'm working with ICT companies. And one of the things I always talk to them is, well, if you use a technology like this, not be pushed by technology. And it should be really, you have to look at it from the user side. And so you have to talk to the doctor. If it's pushing by the industries, it will not work. But, well, everybody knows who is involved in innovation projects. It can be really a struggle. If you look at it, the guy on the left upper side, totally wasted after a race, struggling with his own health. And again, it can be a struggle. If you then look to the right downside, there's the biker is cheering. She finished it. Very happy, everybody. And if you struggle, you just have to keep on going on, doing innovation, doing projects like this. And in the end, our patients will profit from it. Well, thank you very much. This was the end of my presentation. So I'm looking forward to getting the questions at the end of the session. And I hope I pointed out what I wanted to say, that one of the things is we have to work together. Thank you.
Thank you, Dirk, for your great presentation. I think it's very interesting because this kind of device unleash one very important force of the telemedicine. That's the fact that we can work together, work connected as a doctors, We learn at medical school to earn solo, but this kind of device can unleash the power to work together. So thank you for your presentations, your ideas.